all the respected doctors present here. I, Dr. Snehal from the USV medical team, welcome you all for yet another interesting session in the CME India series, where today we will be touching upon two important and interesting topics. Surya Namaskar in Type 2 DM, what evidences do we have? And the second topic being ancient Vedic and yoga practices and modern evidence-based medicine integrating care. Without much ado, I would now like to introduce to you our esteemed moderator for the evening. We have with us Dr. N.K Singh, sir. Sir is the editor for CME India. And now I would request Dr. N.K Singh, sir, to take it forward with the session and introduce rest of the faculties for the evening. Handing over to you, Singh, sir.
Thank you, Snehal, Dr. Snehal, for our esteemed outed one, because something very unique we are going to present today. As everyone is aware that the yoga and modern medicine are not exclusive but complementary systems, and their combination can today provide with a very holistic health care. So I think for that we have got very esteemed speakers today. Already Dr. Snehal has introduced. So I just welcome Dr. Manohar. Please, Manohar came from the Manipal, Bangalore. His current position is consultant physician at Manipal Hospital and Sarda Medical Center, Faculty of Emergency Medicine, and he also chairman of the RSSDI Karnataka chapter. He is a great guy, and I think you always a great promoter of the lifestyle modifications.
Thank you.
I also welcome. Yeah, thank you. So our next panelist, Dr. Hemant Bhargav. I think in India today, all of us know him. He is associate professor, integrative medicine, Department of Integrative Medicine, National Institute of Mental Health and Neurosciences, that is NIMHANS, one of the most wonderful institutions in India. From the Bangalore itself, he is the faculty member, as you see, the research and academics of the task force of UGC, Government of India for Yoga Education and Research, and prophylactic Ayush guidelines for children during the COVID-19 pandemic, and Ministry of Ayush, and so many things, and tele-yoga guidelines he has made, and Manas Mitra webinar series he has done. Lots of research and publications, especially what science has given us and what are the evidences today we have got with the yoga. He has done a wonderful work and many awards and achievements. So welcome Dr. Hemant Bhargav. Next, I also welcome Dr. Bijay Patni. He is part of our webinar. He is the current designation is the HOD Diabetes Wellness Clinic, Kolkata. And I think in India, everybody knows him. Lots of research awards. And also I welcome Dr. Akash Kumar Singh. He is also a part of us with the current designation of the Consultant Diabetology and Non-Interventional Cardiology, Baroda, Gujarat, National Region and State Conferences. You have heard him. He is also principal author of many publications and many reviewers. So welcome, Akash. With that, I hand over this stage to Dr. Manohar to further proceedings. Dr. Manohar.
Namaste to everyone, and
Dr. Manohar.
An exciting evening. I'm sure when I share it on our social platform, a lot of people have shown enthusiasm in attending this program. So I don't think I should waste time. Very, very important, and Dr. N.K Singh rightly alluded, now it is not modern medicine versus or traditional medicine. It is both together for the win-win situation in our society. So to give our first talk, I would like to welcome Dr. Shambo Samajdar, who is from Kolkata, consultant physician, a lot of research, 72 articles, more than 35 book chapters, lot of awards and achievements to his credit. And many times we wake up with sun rising, and the first thing is sun salutation, what we need to do. So he will talk us and enlighten us about Surya Namaskaras in type 2 diabetes. Do we really have evidence? What is the evidence? And the next speaker, I don't think anyone in the country or many times in the world need introduction. That is Dr. Shashank Joshi. Of course, we all know he's a current work as a consultant endocrinologist at Lilavati Hospital. He always says, I'm physician by heart, and past president of API, RSSDI, and who doesn't know him. And I don't know if my co-moderator, Hemant Bhargav, has anything to say. After that, we'll hand over the session to our first speaker.
Yeah, the only thing that I wish to convey is to congratulate the organizers for putting such an apt topic. We see that in India, the clinical population exposes themselves to modern medicine as well as traditional systems of medicine. And it is always better to learn from both the domains for better care of the patients. So with this, I invite the speakers to make their presentation.
Thank you. First of all, I want to thank Dr. N.K. Singh for giving me this opportunity. And it is a real honor to share my thoughts in this prestigious platform. So maybe next 20 minutes, we'll try to discuss about this important topic, Surya Namaskar practice in type 2 diabetes. But one S is important before Surya Namaskar, that is supervised Surya Namaskar. When we discuss Surya Namaskar, I think we can try to touch upon this broad area, the relationship between sun and us, then little bit discuss about biological clock, and then we'll try to understand what is Surya Namaskar, what is its effect on type 2 diabetes, what are the evidences we have, and at the end, we'll try to touch some important area, because now health is not only the physical, mental, and social well-being, but also it is our spiritual well-being too. So one disclaimer for this particular talk, that when I personally talk about Surya Namaskar, this journey starts almost 2 years back, when though his name is Shashank, that means we know the moon, but he is one of the brightest sun, S-U-N sun, in this galaxy of medicine, we can say. And Shashank Joshi sir had influenced me to do some research work on Surya Namaskar, and we were continuing one investigation over the effect of Surya Namaskar on cardiac autonomic neuropathy. So I'm really thankful to him. So let's start. As one of our distinguished moderator, Dr. Bhargav, has mentioned, and Dr. Manohar also, we should start our day by salutations to sun with this great mantra, that is Namah Savitre Jagadeka Chakshashe Jagat Prasuti Sthitinasha Hetave Trui Mayaya Trigunatma Dharine Virinchi Narayana Shankaratmane. So we need to respect sun, because this is the only source of light and heat for us. But interestingly, this source present periodically. And this periodical presence of sun make all living organism to a certain level of adaptation to their physiology for achieving some optimum level of fitness. And that lead to evolution of an internal biological clock, and that has some level of adaptation to changes with light and heat sources. We can anticipate, our organelle can anticipate day-night cycles and guide organisms in optimizing the behavior and time-specific physiology. And this rhythm, this daily rhythm, which is generated internally, is known as circadian. And when we talk about circadian, there are 3 important building blocks. Number 1, there is one self-sustained 24-hour rhythm generator, or we can call it as oscillator. Also, we have some entraining mechanisms that connect these internal oscillators to external stimuli, which is also known as jade jabbers, or we can call it as timekeepers. The most importantly, the sunlight. And there is one output mechanisms for allowing the timely schedule of different physiological processes. This TIM protein and PAR protein, what happened after the exposure of jade jabbers like sunlight, we can see here how the translational transcription of different proteins happened inside our nucleus. So this system, this transcription, translational feedback loop is totally dependent on the source of the light, that is sunlight, which help us to have different influenced physiological changes. For an example, just now it is 8:15. When it will be 9, so we have our highest melatonin secretion, and that is the time we should go to the bed, and our parasympathetic nervous system activity will generally govern our processes, physiological processes, and sympathetic nervous system activity will go down. Again, in the morning time, what happened? In the early morning, when the parasympathetic nervous system activity will go down, the sympathetic nervous system activity will take the upper hand and make us active. So this system is important, but most importantly, this system is dependent on sun only. So we need to acknowledge this internal body clock. If there is some irregular rhythm in this clock, in this process of clock, if we have abnormal circadian rhythm that is related to different types of disorders, including metabolic disorders, psychiatric disorders, and even cancers. So we need to acknowledge this internal body clock function in proper way. And we always respect these three great scientists who had discovered, rediscovered this transcription, translational feedback loop and enlighten us about the knowledge of biological clock. But long back, we have a great saint known as Maharshi Charak. He had proposed this sun-dependent activity to remain healthy. And later, Sri K.V. Iyer and Sri Krishnamacharya. So when we talk about Surya Namaskar, there is 12 steps, and that 12 steps need to be followed in a sequential way. So as we are talking about 12 steps, there is 2 steps like this Ashtanga Namaskara, the 6th one, and another is the Cobra pose, that is Bhujangasana. These 2 steps not repeated, but each the first 5 will be repeated in the from 7 to, or we can say the 8 to 12. That 5 steps is repeated. And each steps is associated with some specific mantra ucharana. So we can, if we go by this picture, we can see what are the different steps of Surya Namaskaram. But most importantly, as we had started with one ace before Surya Namaskaram, that is supervised Surya Namaskaram, a proper trainer is extremely crucial to do this practice. And when we talk about some concepts of chakras and physically correlated glands. They are beyond our modern medicine knowledge, but I think the scholars in this field are knowledge persons. There are certain, their thoughts are there. We should respect those thoughts, and how Surya Namaskar influence those chakras, and that chakras the modification of that chakras can be correlated with different physiological functions. When we talk about Surya Namaskar and its dynamic intensity, as we had discussed, this is a sequence of 12 asanas that performed rhythmically with controlled breath. It involves static stretching along with dynamic muscular exercises. So it engages almost majority of the joints and muscles. Now, when we talk about the intensity of the exercises, there are different research had been done, and that suggests it varies. This MET varies to 2.9 to even 7.4. That means very high intensity workout also. One study conducted by Modi BS, he had done it with 4 rounds of Surya Namaskar, each round within 3 minutes, that achieved almost 7.4 METs intensity. So vigorous intensity physical workout associated with Surya Namaskar 2. So what are the evidences we have? There are multiple studies. We had quoted some studies. First one, whatever we can see from the Complementary Therapies in Medicine journal, the effect of yogic practice, where they had also included Surya Namaskar and its effect on lipid profile and body fat composition. So the patient were coronary artery disease patient. So they had benefits on top of existing medications. So here we are not saying the patient should stop all the drugs. Drugs are important. On top of drug, if we tell our patient to have a supervised exercise process, so that can help us. So again, another study, how sun salutation improve muscle strength, general body endurance and body composition. So it was seen that sun salutation exercise can be an ideal exercise to keep oneself in optimum level of fitness. This is one 11-month yoga training on cardiorespiratory responses during the actual practice of Surya Namaskar. So what was the finding? Again, the Surya Namaskar arm that conditioned the cardiorespiratory parameters, it was beneficial in terms of different cardiorespiratory parameters, except the breathing rate was not that significantly changed. Another study, the acute effect of Surya Namaskar on different cardiovascular and metabolic system, again that had shown Surya Namaskar practice maintain or improve cardiorespiratory fitness along with weight management. This is another interesting study where researcher had shown the effect of regular yogic training on 2 important hormone, that is growth hormone and the DHES, dihydroepiandrosterone sulfate. What they had shown? They had shown the basal level of this growth hormone and DHES in the human body was maintained in the regular yogic training arm. In that regular yogic training arm, they were also doing Surya Namaskar on top of other yogic practices. So it can promote healthy aging. There are studies, just like our drug, one drug does not fit all. So similarly, there are researchers who are suggesting one dose of Surya Namaskar is not equal to all the person. So it does not fit all. So it could be slow type of Surya Namaskar, it could be fast type of Surya Namaskar. And there are studies which suggest if we do slow type of Surya Namaskar, they have more effect on our parasympathetic nervous system decline. Whereas if we have fast Surya Namaskar practice, that can improve the cardiorespiratory fitness better. At the same time, they will not have the similar type of effect on the parasympathetic nervous system decline. So again, maybe in future, we will discuss about personalized Surya Namaskar practice. So when we talk about obesity, again, the studies which took one arm Surya Namaskar, one arm circuit training, and another arm treadmill exercises, what had been shown, the Surya Namaskar practice was associated with effective weight management and most importantly, improving the cardiorespiratory fitness along with upper limb endurance, muscle endurance activity. But at the same time, the Surya Namaskar effective to improve the body flexibility compared to the circuit training and treadmill exercises. So there are certain research which suggest Surya Namaskar can be considered as an alternative for aerobic fitness. So what are the different benefits of Surya Namaskar? If we want to summarize, then it has influence in physical, physiological, psychological health. It has some ameliorating effect in endocrine function and it can promote healthy aging. It has benefit in terms of maintaining good lipid profile with improvement in muscle and joint activity. And there are studies which suggest it can improve liver function, lung function, and kidney function too. So this was one paper we had published in Indian Journal of Geriatric Care, where we had proposed if we use Surya Namaskar practice in a proper way, in a supervised way, in a personalized manner in the elderly population, that can help us to have a healthy heart in elderly. So if we try to dissect some evidences on type 2 diabetes, we know overall when we talk about yoga, it shows better improvement in glycemic control in terms of HbA1c, anxiety score, depression score, quality of life as compared to exercise alone. So it could be an additive measures with exercise. And sometimes when we talk about yoga, it is always superior to exercise alone in controlling all of overall psychological parameters. When we talk at yoga as therapeutic intervention, this was a paper where they had used Surya Namaskar practice too in the yoga group, and they had shown the yogic interventions have beneficial effects on glycemic parameters and lipid parameters. Even this was a program on type 2 diabetes patient prevention program. So they had developed it, and the initial reports are suggesting that yoga in type 2 diabetes prevention can be a good alternative, good weapon on top of other lifestyle measures. So this randomized control trial, it is not completed yet. We'll wait for its final result. So we know this ACEs of ADA-ESD guideline, which came up in 2022. which had emphasized about stepping, sleep, strengthening, and also not to sit much. On top of this, I think maybe in future, if we do more research, if we have more generation of good evidences with this Surya Namaskar practice, so Surya Namaskar or sun salutations also can enter into this cycle. And already this time they had emphasized on the chronotype. So how we should go to bed early and get up early, the EST-ADA guideline is telling us. But we know our ancestors had taught us long before, almost 4,000, 5,000 years ago, when to wake up and how to practice yoga in the Brahma Muhurta, maybe at around 4 a.m. when our physiologically parasympathetic nervous system is going down and sympathetic nervous system activity is going up. So as we are talking about sympathetic and parasympathetic nervous system balance, again, there is a huge role of this yoga practices, especially the Surya Namaskar practice. There are certain studies which had shown those LF-HF ratio, the improvement is associated with modified yogic practices. We are doing some clinical research on yoga. We had done one small review recently, and we had found in each case in that COVID-19, also elderly and COVID-19, we found that yoga can be a good option to prevent COVID-19 related mortality and morbidity. We had done one study on Om chanting in COPD patient. There also we had found the beneficial role of Om chanting on top of pharmacotherapy. And this was a very interesting study we had conducted, the Gayatri Mantra chanting and its effect on attention, memory, anxiety, and mental state in young athletes. I think this is a very high time when we are talking about mantra chanting. So in Surya Namaskar, that is not only exercise, that also tell us about the importance of chanting some mantra. So in Surya Namaskar practice, the meditation part is also taken care. Yoga is a compact yoga where we are getting some aerobic activity, muscular flexibility exercises, on top of that meditation. I think this picture, many of us know, this is a symbol of Ramakrishna mission. What we can see here, there is one wavy water. This wavy water is symbolic of karma. This symbol or logo of Ramakrishna mission actually drawn by Swami Vivekananda. And Swami Vivekananda had explained each meaning from his teaching. I am just quoting this. So wavy waters, that is the symbolic of our karma. When we talk about lotus, lotus means our bhakti. Then rising sun, there is one rising sun, that is sun of jnana or knowledge. But most importantly, what we can see, the encircling serpent, and that is the indicative of yoga and awakened Kundalini Shakti. So that is the attention part. And if we have coordination between karma, bhakti, jnana, and yoga, then we will ultimately reach the Paramatma. And who is that Paramatma? That swan in the picture. So Gyan, Bhakti, Karma plus yoga. Yoga means here attention. That can help us to reach to the Paramatma. So power of yoga is extremely important. If we do not have this power of yoga, we'll be devoid of power of focus or attention or concentration, which is very essential for our life. So attention, and when we are talking about Surya Namaskar practice, attention is something which is immensely associated with this yogic practice. So concentration is the only key to the treasure house of knowledge. And when we differentiate between an ordinary pupil and a legendary person, that lies in the degree of concentration only. So how we can maximize these personal resources, that means attention, then time and energy. So when we talk about attention, we should remember this is the prime commodity. This is the most valuable resource. And then importance of time, then energy, and most importantly, we need to isolate from distractions. We need to prevent self-scatter. This is the beautiful picture we can see. What is that? That hood is important. We need to have a embrace like cobra's gauge that help us to get a precision focus on the prey. So laser-like precision, steadfast guarding, and selective isolation. Shut out its surroundings. That is the final step of deep focus. And I think every enjoyable activities, they are not likely, but most enjoyable activities are not natural. They demand an effort that initially one is reluctant to make. But once the interaction starts to provide feedback to the person's skills, it usually begins to be intrinsically rewarding. This was from Mihaly, from his book, famous book, Flow, the Psychology of Optimal Experience. Again, the best moments in our lives are not the passive, receptive, relaxing times. The best moments usually occur if a person's body or mind is stretched to its limit in a voluntary effort to accomplish something difficult and worthwhile. You may look your mobile and just check your Facebook for maybe 30 minutes. Then after that, what happened? You will not feel happy. I am damn sure about that. But I am also damn sure if you do a good jogging exercises or any good thing, if you write a good paper and give an effort of 30 minutes, that will give you reward whole day. So we need to be attentive. I think many of us know this great innings when there was no cover drive in that 241 in Sydney. But we know the master is one of the best cover drive player. So we need to believe, we need to understand the power of focused attention. And every time we need to be attentive. When we are talking, we are chatting with our friends, that time also the attention is required. Reinforcement is important, and reinforce the idea that keeping the mind under full attention in all activities is crucial for developing a disciplined and focused mindset. So my request to all of you who are listening, let's start this process of Surya Namaskar in the school children's, in the school going people. If we can start Surya Namaskar in all schools, I think what fear is stuck in our head is India may be the, or already become the diabetes capital of the world. We can prevent the cardiovascular disease capital of the world. We can reduce the number of cardiovascular disease, metabolic disease, diabetes in our future years. If we introduce this noble practice, Surya Namaskar, in our school going children, because that not only improve the physical health, but also improve the social health, the mental health, and most importantly, the spiritual health. I think this picture is important here. Why? This is a picture of Ma Radha, Radharani. And you can see behind Krishna is checking her. But where she is worshipping? She is worshipping Sun, Lord Sun. You know what happened? Why Radha, the birth of Radha? There is one story. We know when there is one after this Samudra Manthan, when the Amrita came up, nectar came up, so everyone was quarreling. So God take the roop of a beautiful lady and serving that to the other, the Amrita to the gods and something else, Sura to the demons. Everyone was that roop was attracted by every gods, including Shiva. Lord Shiva was attracted by that roop. Only the Lord's son was checking and thinking, this could be my daughter. So Lord Vishnu bless the son that I will become your daughter. And we know that Radha is just a roop of Bhagavan Vishnu only. And Radha's father was the roop of Lord Sun. So I think we need to, when we are doing yoga, we need to be very much about this above of this Rajagun Samadbhava, Kama Esha, Krodha Esha, Rajaguna Samudbhava, Mahashana Mahapapma, Vidveno Vihavairinam. So this is what we required while practicing yoga, and that can make us a good man, a good human being. So with that, again, I want to thank CME India for giving me this opportunity for share my thoughts on this topic. Thank you very much.
Excellent deliberation. बहुत समझदार है आप, and what in-depth analysis of all these things. And I think I'll quickly take a comment from Dr. Hemant Bhargav, because he is the man behind a lot of technicality and works on the yoga, before we invite the next speaker.
Go. Yeah. Welcome, Dr. Shashank. Yeah.
Yes, sir. So I think Dr. Shambo Samajdar has gone to the history of Surya Namaskar. In fact, there are verses in Rig Veda also, much before Charak Samhita, where this technique has been mentioned. One very important point here is when we perform Surya Namaskar, this particular aspect of Surya Namaskar where you have to bend forward, So here, if you are, making a nose dive, if you bend from your lower back, so definitely there will be pressure on the anterior aspect of the disc, and it will increase the risk of disc prolapse and problem. Then to accommodate that, what people do is they do a swan dive. They basically exacerbate their lumbar lordosis. So both the methods are not correct. While bending forward, it is better to bend your knee joint and loosen up your hamstring and put more pressure on the quadriceps, and then make your pelvis and the chest as one unit and bend from your hip joint in such a way where the spine remains neutral. So I think this is one aspect of safety while doing Surya Namaskar, especially in elderly population. And another important point is it is mandatory that after this practice, you lie down in Shavasana, and if possible, bend your knee joints and lie down by touching your whole spine to the ground. And there should be a relaxation at the end. You cannot just do Surya Namaskara and get back to your work. So these are two domains which are from yoga therapy point of view very important. I once again, congratulate Dr. Shambo Samajdar for, providing some evidence here. But definitely before we make statements, like Surya Namaskar can stop India becoming the diabetes capital, we need to do much more research and generate more quality RCTs. Most of the RCTs which you showed did not have only Surya Namaskar, So we have to do more research in that area, and then only we can make such statements. Thank you.
Thanks, Dr. Hemant. And I am very happy to invite our guru and mentor for many of us, Professor Shashank Joshi. I don't think he needs any introduction. Sir has joined from a place where connectivity is slightly questionable, but I think he will enlighten us on the next topic, ancient Vedic and yoga practice and modern evidence-based medicine, integrating both of them. Over to Shashank, sir.
Today we are going to discuss a very interesting subject, And I have to thank the organizers for this very wonderful topic, ancient Vedic and yoga practices and modern evidence-based medicine. And clearly this is the need of the hour, because we need to integrate all our ancient wisdom, our ancient scriptures, because they came down from generations, and the experience they had is real world evidence and much more robust sometimes than the modern filters of evidence-based medicine. But is there any truth in it? Is there any science behind it? Or is it just fiction which we are talking about? So if you look at yoga and look at Vedic origins of yoga, we can link the Upanishads to the yoga. You know, yoga is actually union of the mind. It is to unite. And when our sages were there, they were yoking first the mind. The idea yoga came that one has to control the lower senses. So the Yoga Sutras were nothing but awakening the higher intelligence and controlling the lower senses. And that is why there are different parts and components of yoga. We have the Kriyas, which are the cleansing processes. We have the asanas, which are the postural exercises. We have the pranayama, which are the breathing exercises. We have then the dhyana, which is meditation. So there are 9 different components of yoga, and they need to be dissected in an evidence-based fashion in the modern era. But there's a lot of science and biology and biological basis of various yogic practices. So clearly you can see that the linkages of the various yogic practices has been generationally there in our Indian culture. If you see this very nice message from C.A. Aurobindo, it is the young who must be the builders of the new world, not to accept the competitive individualization or materialism. And we need to ensure that the future of India is not enslaved by the religious dogmas, but we should transform them, and we should go and search the truth and the complete truth. And therefore, when we are trying to do that, we will undergo a journey of self-realization. And in that whole self-realization is the pathway towards the Almighty or the God. But clearly, we need to be holistically whole-minded, and we should tailor and labor to generate evidence-based science from our old scriptures. So if you look at the integration of medicine and evolution of Upanishads and classic yoga, there has been a transition of the rituals from Vedic practices to philosophical insights of Upanishads. And therefore, whether it is a concept of self, of reality, of liberation, all these have been inscribed and taught by the sage Patanjali when he integrated the traditional classic Vedic concepts into the classic systems of yoga. And this actually evolved and continued the spiritual practice in India. And therefore, the Yoga Sutras, which were compiled by the sage Patanjali, is one of those old scripts and texts which needs to be appropriately translated, understood, and then inscribed, and then probably tested in the modern world. His work of sage Patanjali was nothing but a culmination of the earlier traditional practices, and he tried to put a systematic yogic philosophy in his whole philosophy. If you see the Veda Raksham, and if you look at the trees of Vedas, we have the Atharvaveda, from which Ayurveda is born, and it's a complementary school of medicine, just like we all belong to the allopathic school of medicine. And then we have the Upanishads, which actually gave birth to the yogic philosophy. And fundamentally, what are the components which we ingrained from the Atharvaveda and Upanishads, or the Ayurveda and yogic philosophy? We all know that we live on planet Earth, which has elements of air, space, water, and then clearly if you recognize these elements, including the earth, then we have the doshas. Doshas is the physical constitution. And if it is air and space, it is vata, which is actually a constitutional state. Then fire and water, which is pitta, and earth and water, which is kapha. So these are the pravrittis or the doshas, which are actually the constitutional states of mind. And if you look at the guna, which is the mental state, it is the rajas, the sattva, and the tamasa. So if you look at the physical or the mental health, and if you look at the traditional concepts, it had 3 classifications: the vata, the pitta, and the kapha, the rajasa, the sattva, and the tamasa. And these doshas and the gunas, which is the physical and mental state, then led to a practice of yogic practices. So if you see the 8 limbs of yoga, it is called Ashtanga yogic practice. And of course, there is probably a 9th limb which I alluded to. Then if you see the dietary recommendations, it is Ahara. Ahara is actually the yogic diet. And then we have the Vichara, which is the minds or the thoughts, the pure thoughts, the behavioral and the cognitive thoughts as per the traditional understanding. And then it is a Vihara. Vihara is lifestyle modification, including the sleep, the physical activity to harmonize the biorhythmic clocks. If you look at a very holistic program, which incorporates the yogic practices, the Ahar, the Vichar and the Vihar for mental health and overall health, it fundamentally balances the doshas and the gunas. And it fundamentally, from an autonomic standpoint, it balances the sympathetic and the parasympathetic nervous system. So if you look at the Panchakosha model, which has a correlation with dosha and a guna, you can see that the Annamaya, the physical layer, the Pranayama, the energy layer, the Manomaya, the mind layer, the Vinamaya, the intellectual layer, and the Anandamaya, the layer of bliss. You can see that the Vata, movement, Pitta, metabolism, and Kapha is lubrication are the 3 Annamaya kosha from the dosha philosophy. And if you look at the guna, it is the Manomaya, which is the Sattva, the calmness, Rajasya, the restlessness, and Lethargy, the tamasic. So the pravrittis or the guna are eluded from there. So when you look at Vedic medicine, and if you look at a holistic approach of Vedic medicine, which is the core DNA of the ancient system of the traditional Indian healthcare, is a balance between the body, mind, and spirit. And this Vedic concept of health is not just absence of disease, but a state of complete mental, physical, emotional, and spiritual well-being. And therefore, the aim of the traditional spiritual or Vedic medicine is to prevent illness, promote longevity, and nurtures individual inherent healing capabilities. So if you look at the chariot analogy of understanding one's own self from the Katha Upanishad, the chariot analogy means the body is the chariot, the senses are the horses, the mind are the reins, the charioteer is the intellect, and the passenger is the Atman, which is the higher self. And that has a relationship and distinction between the physical body, the chariot, and the higher self or pure consciousness, the Atman. The control of senses from horses through the mind, which is the reins, is guided by the charioteer to achieve the psychological well-being and spiritual growth. Of course, we are in a mathematical model because evidence-based medicine of modern era believes in mathematical modeling of this thing. This was also there in our old scriptures in the Sankhya philosophy. Sankhya is mathematics or numbers, science of numbers. And there are 2 independent realities, the self, which is the Purusha, and the Prakriti, which is the matter. And achieving a union of the self with the higher consciousness was the ultimate goal. So if you look at it and dissect it from an evidence-based standpoint, that is how it is. So if you look at Sairara or body, based on the Katha Upanishad, you have the Atman, the Buddhi, the Manas, the mind, and the Indrayas, which are the senses, whether it is your tongue, whether it's your hand, whether it's your nose, whether it's your ear or the eyes. And that is how the entire philosophy has been based. But if you look at the bioenergetics of yogic science and deep dive into it, there is something called as a Kundalini Shastra. And this is nothing but the energy biokinetics. If you look at a holistic energy balance of total energy intake, total energy expenditure, it is nothing but the Kundalini energy, which comes from the chakra philosophy. And you know it is dormant, which is limited to spiritual understanding and is grounded in mundane and selfish views. It could be aroused, which is a temporary spiritual insight with energy and lacking stability, or you could be an awakened soul or the awakened Kundalini, which is stable transformation of consciousness and progressive spiritual realization. So yoga, or a person who practices yoga, which is yogi, aims at awakening the Kundalini energy to achieve Kaivalya, which is freedom of the inner self of Atman, and controls the body's center, which are chakras and senses. So that is how the root philosophy has been ingrained and engrossed. It is important to simplify it and understand it as modern medicine scientists. So when we go beyond physicality and look at the spiritual journey of yogic, spiritual and bioenergetic journey, yogic focus our yogi's focus or a practitioner of yoga's focus is not just physical strength or athletic abilities. It is controlling to develop the Atman through abstinence or yamas, purity, moderation, and modesty, which is niyamas. It is integrating lifestyle by appropriate incorporation of dietary and physical activity principles based on niyamas and yamas. And then once we put this into a construct and do a systematic practice, you will have a better vitality, better physical perception, better social functioning, better quality of life, and then you can develop exceptional physical abilities. The trained yogis have muscular flexibility, they have strength, they can control stress, and they, through the practice of various asanas, and modify and handle stress better. So fundamentally, the whole energy expenditure concept is there in the yogic practices. It is the total energy expenditure, the resting energy expenditure, the basal energy expenditure, and the metabolic indices and indicators and measurements to study body's energy balance and control. And when you activate the Kundalini energy activation, there is a clear gap in research, and we need to do good evidence-based science to correlate the modern energy equations and study the Kundalini energy equations and activations. Also remember that we can correlate metabolic activity to Hatha Yoga, because Hatha Yoga is nothing but a combination of dhyana, pranayama, and asanas. And when you have the physical intensity of Hatha Yoga, the VO2 and the METs, the metabolic equivalents and oxygen consumption can be measured. So actually we can measure the Hatha Yoga practices by the MET values against physical activities like a walking or a jogging or a cycling. So you can have different Hatha Yoga protocols, a low intensity protocol which is limited for cardiovascular benefits. We can increase it to HITT protocols or cardiovascular reserve protocols of Hatha Yoga, and then we can move them to the next level by local muscular adaptation, some of them with physically intense asanas, some of them through breathing exercises or pranayama, or sometimes through improving concentration of physico-psycho control. Asanas are not just postures, though I alluded to them as postures. These are postures designed to purify the body, to improve health and promote spiritual growth. And there is an evidence base because they improve flexibility, they improve the tone and the strength of the muscle, they enhance respiratory and cardiovascular health, and they improve athletic performance and protect us from injuries. So there is a systematic review and meta-analysis published by Brooks et al., which compared usual care to yoga, and there was a significant improvement in the exercise capacity and overall quality of life. And in rehabilitation programs, we have good RCTs to suggest and good meta-analysis to suggest that there could be an additional element to this. And you can see here that the health-related quality of life as well as exercise capacity in the meta-analysis, which shows yoga versus control and the positive influence this practice has over usual care. So clearly, yoga has an impact on exercise capacity and health-related quality of life in chronic disease, and the evidence base is building. If you look at the yogic practice on glucose control and pre-diabetes state, this is a meta-analysis which looks at the effects of that. And you can see that various impacts have been studied. Pranayama, for example, is a breathing technique, just like we talked about the asanas. It focuses on controlling the breath by prana, which is vayu, which is the flow of life, and the respiratory function, the cardiovascular health, and reduction of stress and anxiety. And clearly, we have data to suggest that when you do this type of breathing or pranayama, it stretches the fibroblasts surrounding the lungs, generates hyperpolarization current, synchronizes the neural tissue, including the hypothalamus and brainstem, and the resting membrane potential polarity in the surrounding tissue, decreasing the metabolic activity, increasing the parasympathetic tone or dominance, decreasing the blood pressure, heart rate, and oxygen consumption. Similarly, when you do pranayama, it does the slow adapting stretch receptors activation, which generates an inhibitory impulse to neural tissue, synchronizes them, and decreases the action potentials, thereby again increasing the parasympathetic domination. And the final component is dhyan. It is nothing but a meditative practice through deep concentration with profound and peaceful stillness and insight. which supports and is anti-anxiety, anti-stress, anti-depression, and not only improves attention span, memory, but also regulates emotion, which is so critical on health impact. And therefore, meditative therapies also have RCTs now of the medical application of these randomized control trials. And you can see here, this is a publication from Asia, which clearly shows that both fatigue management and sleep quality, as well as antidepressive effects, are seen in people suffering from mental disorders, and meditative techniques improve attention awareness and can actually lead to transcendence. What about food behavior? How can we align modern intermittent fasting with Indian tradition? Because fasting and feasting has been a part of our Ritucharya. And intermittent fasting is a health trend which involves cycling between periods of eating and fasting for weight management, metabolic health, and longevity. And the traditional Indian practice of taking dinner before sunset, tying it to the natural circadian rhythmic processes, benefits for digestion, sleep quality, and detoxification processes, connecting meal timings with circadian biology, highlighting how early the dinner practices align with optimal metabolic and physiological functions, are akin to principles of intermittent fasting. And we have data from RCT, which clearly show that intermittent fasting in humans compared to non-intervention clearly has some impact, though it is much less than caloric restriction. And this is data published from BMI, waist circumference of intermittent fasting on intervention versus non-intervention. For example, a simple concept of fasting, and we have Ramadan fasting coming up very soon, or we have Lent, which has just started. Ash Wednesday was there a couple of days back, and we have Ekadashi. Ekadashi is a traditional Indian fasting practice. Actually has a science behind it because it's on the 11th day of the lunar cycle, focusing on the spiritual significance for physical and mental detoxification. And there is a direct health benefit with periodic fasting because it improves the autophagy or cellular cleanup. It improves the metabolic flexibility and mental clarity. And it has a direct parallelity or concordance with the intermittent fasting research. So traditional fasting practices in Indian culture are important, and we need to underscore them, do some science behind them, do some systematic research behind them, and move them to the next gear. Sattvic diet can enhance longevity and spirituality. In fact, clearly this is a diet which increases energy, happiness, calmness, and mental health, promoting health and longevity. And these foods are the ones which were consumed, like for example, 100 to 150 years per Mahanarayana Upanishad, and were given by the saints. Fresh fruits, nutritious, tasty, supporting the life. And it's all about fruits, vegetables, sprouted grains, roots, tubers, nuts, cow milk, curd, and honey. These are prudent to dietary benefits for well-being and spiritual progress. The Rajasic diet is fueling passion and activity. It stimulates emotion, jealousy, anger, and selfishness. This is recommended for leaders and fighters, which excite and boost confidence. These are bitter, starch, salt, spices, hot and dry, and it has all the radishes, fried food, and it increases the intelligence, but also creates negative emotions and fantasies. And finally, the Tamasic diet, which contributes to laziness and pessimism, and again is undercooked food, over fried food, high fat food, tamed animals, onions, mushrooms, and you can see that they enhance negativity, tamasic, criminal tendencies, and hamper growth and lower life expectations. So if you look at the guna-based food map and food metabolic signatures of nutrition and mental health, the Sattvic is promoting the highest micronutrient density with clarity and calmness. The Rajasic is moderate micronutrient density with action and passion. And Tamasic is the lowest micronutrient density with lethargy and negativity. And the nutrient composition and fiber content is similar to all types, but the fat content is highest for Tamasic and lowest for Sattvic. And the daily intake is again variable for Sattvic, Rajasic, and Tamasic respectively. Clearly, when you look at the correlation of micronutrients and mental health, the Sattvic has the highest correlation with overall micronutrients with a statistically significant p-value, while Rajasic is correlated with B1 and Tamasic is linked with zinc, iron, and anxiety. So if you look, the evidence suggests that Sattvic foods have superior health benefits compared to the Tamasic or Rajasic foods and improve the well-being. So Vedic dietary practices or ahara is very, very important because sattvic foods improve health and well-being, and seasonal foods with Ritucharya actually are designed for one's dosha and constitution, and therefore that was the first description of mindful eating. The herbal wisdom of Vedic medicine, based on the Vata, the Pitta, and the Kapha, which are the body's doshas, were based on these Vedic practices. For example, turmeric for inflammation, ashwagandha for stress relief, and they had to balance the individual's constitution, which is Prakriti, and the current imbalance, which is Vikruti. And it is important for Prakriti to ensure that the Vikruti is corrected, and this is the precision, personalized approach to Vedic medicine. For example, turmeric or curcumin is a clear data now to suggest that it improves the cognitive function, it is anti-inflammatory, and it is an excellent and great adjuvant as a complementary mechanism in terms of a versatile medicinal herb. We had compiled data on therapeutic role of yoga in type 2 diabetes, and you can go through the entire data which we have published. I don't want to go into the details, but I just want to conclude that it is important to ensure and enshrine that don't be dismissive of our ancient wisdom and ancient scriptures. Pick up the lifestyle points which have been ingrained by our saints, independent of the religion, and try to implement them and do some scientific constructs so that we can use modern RCT science and pick up tips from the ancient scriptures and wisdoms and Vedic practices to live a better quality of life, a longer life, and a healthy life. So if you very clearly recognize Yogastha Kuru Kurmande Sada Gavacha Tanacha, clearly you can see Siddha So Samavakutva Sama Yoga Ruchi, which means be steadfast in your performance of your duty and be detached from success and failure. And when you are into a situation of equanimity, in equilibrium, that is nothing but yoga. So yoga is a state of equilibrium. It is a stage of balanced energy kinetics. It's a state where you balance your sympathetic, parasympathetic systems. It is actually a state of mind, body, and spiritualism. And it's a state of self-realization. And it's very, very important that we as modern medical scientists learn the tips of wisdom from ancient Vedic scriptures and adapt them to our modern culture, modern lifestyle, so that we can have better quality of life and a longer and a healthier life, particularly in chronic diseases. We can use them and tap them as excellent adjuvants in modern medicine so that we can improve the quality of life of people we are dealing with. Thank you so much for a patient hearing.
Excellent deliberation, Shashank sir. Thank you for that. Before we move on to the question answer session, live, do you want to make some comments, Shashank sir?
So first of all, I have to thank the entire CME group, particularly Dr. N.K Singh, my good friend, for actually allowing me and Shambo to speak on these topics. Because these topics sometimes are viewed by modern medicine experts as an antithesis. So first of all, I'm grateful to all of you for giving me this opportunity and Shambo this opportunity to speak on this topic. And secondly, I think the idea of this exercise is not just to stop here by a dialogue or discussion, but I think all of us should come together to generate some quality of evidence. And I would ask each one of you who's hearing this, led by Dr. N.K Singh and Bijoy and Manohar and everybody, and of course Shambo and Hemant and Akshay and everybody, that we really need to up our ante and look at the science behind all our scriptures, encapsulate them, and make small little research programs and RCTs and generate through the conventional RCT evidence-based output some good degree of science, because we are all committed to patient care, patient well-being. And I think rather than looking west, we should look east, we should look inwards, we should look within our own country and see how we best optimize both our
medicines from RCTs, which we are there for solutions, but also use our traditional techniques and methods and scientific scriptures to see how we can help patient care in general and wellness in general, because it should be a way of life. So I'm really grateful to all of you for a patient hearing, and grateful, and I'll be happy to, more than happy, me and Shambo, to answer any questions. Thank you.
Dr. Hemant, I know you're doing a lot of work on these lines and also generating evidence. And we already have discussed even with KRSSDI that we have two arms of patients, people involved in yoga and aerobic exercise. I think it's really wonderful work in that context. You want to share a few thoughts on it and then move on to the question answer session?
Yes, before that, I would like to congratulate Joshi sir. I think it was one of the most comprehensive lecture, compiling all the different aspects of the traditional medicine aspects, along with good concrete evidence. He could show a lot of meta-analysis. I think in a long time I have heard such a comprehensive lecture. Thank you so much. It was a treat for me, and especially the two aspects where you brought in the concept of diet, the ancient diet, sattvic rajasic diet, in a evidence based manner, and that definitely a lot of research can be done. The ekadashi fasting idea was wonderful. Kundalini energy and the energy equivalents in the modern, those dimensions are really path breaking dimensions where we can go ahead in a step by step manner. So to the younger generation like us, people like you, Joshi sir, N.K Singh sir, you are the guiding forces who can give us directions. And I personally got a lot of wonderful directions in which I can work in the years to come. So I would like to express my gratitude to Joshi sir and Singh sir for giving this opportunity. Now, what Manohar sir is talking about is a research that we did, a small research during the KRSSDI conference. And there we divided people into two arms, and what we did was, it was a simple research where one group performed a yoga practice, another group performed aerobic exercise, and we simply just measured their blood pressure, their heart rate, and their respiratory rate. And we observed that the effects were exactly opposite. They were going in the opposite direction. The sympathetic activation, blood pressure, heart rate, respiratory rate was high in the aerobic group, whereas in the yoga group, the physiological effects were going in the exactly opposite direction. And when we come into the energy expenditure and all, we were able to match the exercises in a way, yoga practices in a way that they would match in the energy expenditure. So it is not about bending the body in a particular way. It is more about where your awareness is, where your mind is, how synchronized is your breath with your movement, and in how much ease and relaxation that you are going into the posture. So yoga becomes a tool to connect your body to your breath to your mind, and to integrate you as a personality. So that is the way that it differed. So this is the insight that I would like to share. Thank you.
Well, I'm just looking into the questions here, and one of the questions is the answer looks very obvious, but do relaxation technique, meditation, and yoga lower blood pressure? Maybe some evidence someone can put forward. Dr. Shambo, would you like to take the question?
Yeah. So actually, if we go by one very recently published systematic review and meta-analysis on the effect of yoga on hypertension, so it had suggest, yes, it reduce blood pressure, and the diamond is suggestive in and favoring the yoga arm. And very interestingly, one systematic review meta-analysis done in India among the pre-hypertensive population. And there also they had shown from pre-hypertension to hypertension conversion was statistically significantly low in the arm who are practicing yoga. So I think, yes, there are certain connection, definitely. And as we had also described one connection of our autonomic nervous system activity and the effect of yoga on that, the balance, restoration between the parasympathetic and sympathetic nervous system activity that may facilitate this type of finding.
So just one comment here on blood pressure. We have conducted an RCT not published. Shambo is going to be an author of one of them. Is that we have done a simple asana called Shavasana. Shavasana is a cork posture. And if you do Shavasana, people who even are on 3 antihypertensive drugs, and we did 24-hour ambulatory blood pressure monitoring, we were able to ensure that the nocturnal dipene was restored, the early morning surge was prevented, and the 24/7 blood pressure control, which was brittle with 3 antihypertensive drugs, completely improved. So also remember that when we are adapting yogic practices, we need to take a construct, do it like an RCT, and then try to prove the proof of concept. This is unpublished work. It will be in public domain probably by May. We are undergoing statistical analysis. But it's a very simple thing. Shavasana is a very simple thing to do. And if you are able to practice it appropriately and enhance sleep, because ultimately, if you are, and probably, but in this, I have not added a sattvic food arm. But if one is able to integrate a solution, we might have some answers where, in particularly in brittle hypertensives, it makes a difference. The data worldwide is clear cut that with yogic practices, we are able to drop blood pressure, and a lot of evidence is there. The evidence is scattered, but it's very much there.
Yes, sir. Another point which I would like to add here is the research done by Shirley Telles et al. They were able to demonstrate that selectively breathing from the right nostril and the left nostril had a differential effect on the blood pressure, especially breathing in and out only from the left nostril and prolonging the exhalation, trying to maintain a ratio of inhalation is to exhalation of 1:2. You breathe in for 4 count, breathe out for 8 count, and shift your breathing from thoracic to abdominal. So this was able to generate the relaxation response much quicker. So a good practice to be done just before going to sleep to bring the sympathetic tone down, and then the quality of sleep also becomes better, and this also helps along with Shavasana.
Excellent inputs by all of you. Thank you. And the next questions look quite odd. Yoga is beneficial. However, the literature does mention some yoga practices are not beneficial, like Adho Mukta Vakrasana and Sarvangasana. I don't know where they got this from. So, any opinions from the?
I think they mean Adhomukh Shwanasana. It is the Parvatasana in Surya Namaskara, which is Adhomukh Shwanasana. There is Adhomukh Vrikshasana is probably, they are talking about a half Shirshasana kind of a pose. So here, we have actually tried to measure blood pressure in different poses. And contrary, to our understanding, we feel that the blood circulation to the brain will change if you are bending the head down. But the regulation of the blood flow to the brain is so tight that it is not affected by such movement. In fact, such kind of movements have actually helped enhance baroreceptor sensitivity. So it is mainly, you should be able to use props and support yourself properly and maintain it in a relaxed state of mind. It is more of the stress of performing these asana that is harmful rather than the posture per se. So doing it in a sthiram sukham asanam way. Our HRV studies, in different asanas actually showed that Sarvang asana was one asana which was the most potent asana in bringing parasympathetic dominance. So, in fact, if you yourself try, you feel very much relaxed when your head goes down, because it is normally always the gravity is working and pulling the blood always down towards our feet. And these are some postures where it reverses. So therefore, I do not go with this idea. It is mainly the relaxation in the final pose that matters.
Dr. Hemant, may I pose a question?
Two comments.
Sir,
Yes,
one, you also tell something about the yoga nidra or the effect on the blood pressure. Yoga nidra.
Oh, yes, yes.
Just before Hemant comes in NK, just 2 comments.
Yeah.
I think the question of negativity comes from 2 things. One is yoga, like if you give insulin, there is some education involved in it. and there is an indication and contraindication. Similarly, when you are practicing, whether it's a Kriya, whether it is asana, whether it is a dhyana, whether it is a pranayama, any of this prescriptive technique, when it is prescribed, some degree of education, some degree of filter, and some degree of fitness has to be maintained. Also remember that every thing is one size doesn't fit all. So suppose there is a disease like hypertension, suppose there is a hypertension with stroke, suppose there is hypertension with a acute myocardial infarction with heart failure. Naturally, the prescription has to be given. The reason medical professionals should know it is because we are able to fine tune these micro aspects for that individual patients. So it's very, very important to recognize that just like drugs have contraindications, there are contraindications for some of the yogic postures too. And I totally agree with Hemant that you see some of the things like Ardha Shirsasana or complete Shirsasana, their rationale and reasoning is very different because that was an era when there was no imaging available. And now we have science and imaging, and we have functional imaging also available now. So we are able to construct all this much better and map it much better. So I think everything comes with a pinch of salt. Everything comes with some recommendations and with some indications and contraindications. And which is why we need to write it down in a systematic and a simple way so that doctors can follow and lay people can follow. Go ahead, Hemant. On Nidra, I think
Yes.
NK wanted you to talk on the Nidra, Yoga Nidra.
Yes, yes. So there are systematic reviews and meta-analysis on Yoga Nidra per se, starting from its effect on the brain as well. So there are imaging studies that have shown that each phase of Yoga Nidra is having an impact on different area of the brain. So basically, Yoga Nidra is one technique which has been found to enhance quality of sleep, especially when it is done at bedtime. Secondly, there are studies even in pregnant ladies who have shown that Yoga Nidra technique can reduce blood pressure and risk of preeclampsia. So this is one of the safest technique. Guided yogic kind of a relaxation can be done by everybody, and it is done in Shavasana. So this is another technique that can help hypertension.
Thank you. Manohar, any more questions?
Simplify the. Would you like to comment on Yoga Nidra?
Yeah. Why not?
Moving on to the next question, I'll just simplify it. What is the dose of yoga? In other words, how duration they have asked for? How long we should do? Is there any evidence there? For example, we have exercise.
I will, Manohar, give you an analogy here.
Yes, sir.
Okay, people want quick fixes in life. Okay, so yoga has, or practice of yoga usually has a gestation. Okay, and I call the gestation for getting the true impact of yoga 9 months. Okay, so on an average, if you really want to see a tangible effect of yoga, and if you follow the lunar calendar, see normally how do we evaluate RCTs? Every 3 months, correct? So if you look at it, every 3 months you will see an impact. But after 3 cycles of 3 months each, which is 9 months, if at all you will see a tangible or a palpable impact on a parameter or a variable which you are measuring in biology as an endpoint, you will see impact. Now, it will differ on the endpoint. For example, if it's a mental health endpoint, the duration may be different. If it is a physical parameter like a blood pressure or HRV, which Hemant measures or I measure or Shambo measures, it will be different. So it depends on the bio variable. But by and large, just like molecules will need 2 to 4 weeks to see the early impact, yoga will also need couple of weeks to see its impact. To see its impact happening, then you will need to understand that there is a maintenance phase also. I would like Shambo to get in his clinical pharmacology brain here and pick his brain. But when people ask me the impact of yoga, I always say that you need patience and you need to wait at least for a good 9 months to see the true impact of a yogic practice. And this is completely based on some scripture reading and anecdotal. So I'm not backing up my answer with science, but Shambho will provide some evidence based to it with Hemant. Shambho?
Yes, sir. So we had also quoted one study report, I think, when we are talking about the dose of Surya Namaskar. So depending on the METs produced, so some study had shown if we conduct Surya Namaskar each cycle within 3 minutes, and that could be for 4 repetition of each cycle. So that is equivalent to almost more than 7 METs. So an high intensity exercise. And we need to continue it for two years to reach the maximum cardiorespiratory fitness for that perspective. But again, it depends on people to people, as sir has told, one dose does not fit all. Just like that, one drug does not fit all, one dose is also not fit all. So we need to have a personalized way to assess in which dose the specific yoga acts in its desired level. Just for an quick review, because someone was asking about some contraindication, and sir also mentioning just like drugs, yoga has also could have some adverse drug reactions and contraindications. When we talk about Surya Namaskar, most importantly, the contraindication is pregnant ladies. We know the methotrexate is a category X drug. Similarly, Surya Namaskar is a category X solution, yogic solution, we can say. We should not advocate Surya Namaskar in pregnancy. So this is one thing. Even in some cases when there is severe dysautonomia, we should not prescribe these practices. So we need to understand, and that is why, as I had mentioned in my first slide, while talking about Surya Namaskar, the supervised terminology is important, because when we are planning this project, Professor Joshi sir only had tell us that we should add that word supervised, because it is very important. One yoga, it is not a simple thing. Just like drugs, if I am talking about any drugs, it does not have any effect if it does not have any side effects. Similarly, when we talk about yoga, it has an immense effect in different physiological function. It could produce some adverse effects, and that is why the monitoring is important, and that is why we need people like Professor Bhargav to illuminate us about this type of issues. So thank you. Over to Bhargav.
Thank you, Shambhu sir. Here, there is a study where Iyengar yoga was done in a dose-dependent pattern and in major depressive disorder. And it was observed that the impact was maintained if it was done at least 3 times a week. But the impact was not there when the dose went down below 3 times a week. So, in fact, here at NIMHANS also our experience is that to have sustained effect of yoga, the probable central mechanism through which yoga is working is by enhancing GABAergic tone. So from number of studies this has come up, Streeter et al. Have done repetitive trials, and we have also done it using TMS and shown that cortical silent period increased. So it requires that GABAergic tone to remain sustained. You have a dose of 3 days a week. And initial impact of yoga is on the mind. That can be seen within 4 weeks. Yoga is as effective as antidepressant if the depression is mild to moderate. In 4 weeks, you see the impact on the mind. In 12 weeks, you see the impact on the subtle physiological markers like cardiorespiratory markers or blood pressure. Whereas when you want to see the impact at the level of the body, you really want to see your exercise capacity, muscle endurance, the curvature of your spine. I have seen patients where scoliosis has been corrected by 1.5 years of yoga practice. So the more physical improvement you want, the longer you have to do it. Our RCT on diabetes, which is under review, we observed that with 6 months of regular yoga, means our trial, Indian trials and Western trial are different. Western yoga is a weekend yoga. and Indian yoga is at least 5 days a week yoga, and therefore the effect sizes are quite different. And then the Westerners also write that most of the yoga studies done in India are more likely to be positive. Their dose itself is so low, so we will always get a more positive result, right? So therefore, 6 months of yoga reduced HbA1c by 1% over and above the medication as compared to the control group. So this is the kind of effect that we see.
I may just suggest here, because as you are here, very recently, Ayush also planning to develop one development procedures like drugs or their products, Ayurvedic drug formulations, just like phase 1, phase 2, phase 3 clinical trial. So whether we also can plan this yogic practice, yoga doses in first the normal healthy volunteer, just like phase 1, and we can find some optimum dose, just like phase 2 clinical trial, and then we can go for phase 3 clinical trial after getting that optimum dose. So hopefully in future, if we can plan like this, then the actual effect of yoga can be known to us, and we can believe on this noble practice more.
Only suggestion that I have here is that we should carefully listen to Joshi sir's lecture again and use yoga as a lifestyle and not as an exercise. So it can be done, but along with that, the diet aspect, the mind aspect, the regulation aspect should be there as a part of intervention, because yoga was a lifestyle. It always had 8 limbs. It did not have only the asana part into it. Yes.
I think Dr. Hemant took away the words I wanted to say. So it is not no point doing some asanas for 45 minutes and then doing everything against it for the rest of 23 hours in a day. I don't think there will be any benefit. I think it's a very, very enlightening program. We went backwards, inwards, and this is the way we move forward, is what I feel. And I would like to invite Dr. Vijay Patni for the concluding remarks. Or if the panelists want to have one final say, you can do that, and then I can pass it over to Dr. Vijay Patni. One final take home from three of you. Start from Professor Shashank Joshi, sir.
No, I think I thank everybody once again. And if people here are not practitioners of what I said, whether it is food behavior or whether it is the kriyas, the asanas, the dhyana, the pranayama, please make a beginning. It's never too late. There is no real contraindication. And start slow and be persistent with it.
Exactly.
And the second saying is that all of you all sleep well and be happy.
Thank
Shambo.
you.
Thank you, sir. So actually, again, I want to thank you all, N.K. Singh, sir, Dr. Manohar, sir, Dr. Bhargav, sir, and Dr. Patni, sir. And as I had mentioned, Dr. Akash Kumar, sir, as I had mentioned in the beginning, though the name is, the meaning of the name is moon, Shashank means moon, but he is the sun of galaxy of medicine. So he had influenced me a lot for last 4 years, 5 years to do something about, to know about this yoga. And as yoga means yoga plus, so yoga can only make I to we. So if we can combine I plus I and I, so it becomes we. So to convert illness, as illness starts with I, and make it wellness, so I can be changed to we. So yoga can do that. So once again, I am really thankful to God to get to help me to get some mentors like Professor Shashank Joshi sir, and wish you all that you will have a at least very nearer to the yogic life. And if we can incorporate this type of yogic practices and lifestyle in our school-going children, then our future will be better. So it will be a request to all the policymakers to think about this, whether we can revisit our traditional teaching, which had been started maybe 5,000, 6,000 years back. And it could be useful for as a preventive approach to many diseases, starting from metabolic to psychological to cancers, any diseases. So thank you once again, organizer, for giving me this opportunity.
Yeah, Hemant.
Yes, sir. today's, in the discussion, Shashank Joshi sir's class was very, very enlightening for me, very refreshing for me. This reminds me of a shloka in Bhagavad Gita, actually 15.93, chapter 15, where Krishna says that Kushnami cha aushadhihi sarvabhuta rasatmakaha. It means that Krishna is saying that I become the moon and nourish all the herbs which have medicinal properties. So therefore, moon is no less. Shashank, we need not be sun. Shashank, as Shashank is also nourishing all the herbs. So I feel the same for Shashank sir. And thank you, N.K Singh sir, for giving this wonderful opportunity. I have only one last sentence to say, that yoga is fundamentally a science of turning the consciousness inwards so that we can hold on to the horses of the senses. So till this inward movement turning doesn't happen, we are not on the path of yoga. Once that happens and we get that inner anchor, then everything goes in track. So yoga should be seen that way, and it is whole yogic lifestyle. Thank you.
Dr. Patni, now you can close.
Thank you, everyone. First and foremost, I endorse what Dr. Shambo and Dr. Hemant said about Dr. Shashank Joshi. I don't have to repeat it actually. And secondly, the concept of today's webinar was excellent. And I think we had thought-provoking talk by Professor Joshi and great insight by Dr. Shambo as well as Dr. Hemant. And what we traditionally knew yoga basically was to improve flexibility or strength or improve your health. But what is important, it prepares the body and the mind for so that we can meditate and have some spiritual growth. So that is what is important, and the integration of ancient as well as the modern science, what Dr. Professor Shashank Joshi said, was so very important. And I think not much to say on this, but definitely it was an excellent webinar. And thank you all. I would say Dr. Manohar for conducting so well. Dr. Hemant, your insights, I mean, I need to learn more, and we need to call you actually again and again. He had great insights. And Shambo, you need to speak more on chronobiology and circadian rhythm. I think extremely important. One need to understand to go further.
I think, so I think today's webinar was something unique and something traditional to our Indian healing system. And it is complementary to our modern science. That is the main thing which we want to give the message to the whole world. And as you know, our PM has started the World Yoga Day, and that is a great, I think, success. And something unique is happening in India. And Dr. Bhargav, Dr. Shambo, people like you and Dr. Shashank, I am really very happy that they are propagating the real message from the very Vedic science. And if you just think about the fasting, 10 years back, everyone was saying, oh, it is a useless thing. But today everyone is saying that this is the great healer for all of the diseases. So with that, I think Dr. Akash, I will request Dr. Akash to say a few words and propose a vote of thanks. And then Dr. Snehal will conclude.
Thank you so much, Singh sir. And I would really like to thank our extremely talented speakers and panelists for the evening. Thank you so much, Joshi sir. It's always wonderful listening to you. And not to forget Dr. Shambu sir for adding on the excellent evidences bit to it. Thank you so much, Hemant sir, Vijay Patni sir, Akash Singh sir, and Manohar sir for
We
the
need to,
fantastic knowledge.
sorry to disturb, Dr. Snehalji. We need to hear from Dr. Akash Singh.
Yeah. First, Dr.
Yeah.
Akash,
Yeah.
Akash, first you
Okay.
conclude. Let Akash
Yes.
speak first.
Okay, sir.
In a society which is growing increasingly intolerant, and although a lot of people are going to gym and going to athletics, but they are on the tamasic path, as Dr. Shashank Joshi has described. In this era, yoga is the savior basically, and as Dr. Shashank Joshi has beautifully dissected into the all aspects of yoga, Dr. Shambo has highlighted all the important aspects of Surya Namaskar, these techniques, which are traditional Indian techniques, can go a long way to improve the behavior and the well-being of the society in at large, and this can be a primordial prevention basically for a lot of diseases which are chronic. I thank Dr. Shashank Joshi for so beautifully talking about the yoga and Vedic aspects of it. Dr. Shambo about the Surya Namaskar. Dr. Hemant talks were revelation, and we came to know about all the scientific studies. We are very, very happy that he is conducting so many studies. I thank Dr. N.K Singh sir, Dr. Patni sir for coordinating and arranging all these beautiful series. And I know Dr. Manohar is a great athlete himself, and his presence basically is very, very relevant to this program. I also thank USV for providing the platform for arranging this important series. I now request Dr. Banswari to conclude.
Yeah, Snehal.
Thank you so much, Singh sir. I would like to thank once again Dr. Joshi sir and Shambo sir for the fantastic session. Dr. Manohar sir for driving the discussion, and not to forget Dr. Hemant sir, Dr. Vijay Patni sir, Dr. N.K Singh sir for the fantastic clinical calls that you shared with us today. It was really an interesting discussion, and all the live audiences have well appreciated this session. We also received tremendous appreciation for the previous topic as well. So we really look forward to having such excellent doctors like you on board in the near future with much more interesting topics. Thank you once again to all the esteemed faculty for giving us this wonderful opportunity. Please have a pleasant evening. Thank you.
Yeah, good night. Good night. Good night to you all. Good night.
Good night. Thank you.
Thank you.
Thank you. Good night. Good night.